Namaskar. Let's move further in our inquisition with you about Ayurveda and Dr. Bhatt and Ayurveda. In order to treat a patient, it is known that the diagnosis is a very important, crucial, critical factor. So, Dr. Bhatt, how is diagnosis addressed in Ayurveda?
Yes, Javin, you are right. The diagnostic really forms the base of how the treatment is going to take place. And that is where the Ayurveda, as of today, differs a lot with what we call as the modern medicine. It is very technology dependent. Very interestingly, the clinical methods are very similar. But over a period of time, the modern medicine, as we call, has become more and more dependent on technology. Unlike that, Ayurveda depends much on the clinical aspects. We call it signs and symptoms, the clinical manifestations. We believe that there cannot be anything which will not affect the human life and living. It will always express itself. So Ayurveda is very rich in signs and symptoms, going to a few thousand. There are more than 7,500 signs and symptoms described, covering different diseases. And to put this together, say even a simple papule appearing on your forehead is not simply an acne. It could be expression of many, many things. And that's the beauty of what Ayurvedic knowledge is. Ayurvedic diagnosis depends on three main factors. We call it darshana, observation, sparshana, feeling, touch, and third one is interrogation or inference. By putting right questions, you inform. When you put these three together, that forms the basis of Ayurvedic diagnosis. Further, the text describes these into. There are many classifications of diagnosis. One text talks about Ashtavida, other talks about Dashavida. And when I was a teacher, I used to say to my students that your diagnosis starts the moment you see your patient for the first time, even when he's entering your clinic. And that is the beauty of Ayurvedic diagnosis. We do examine pulse, we do examine tongue, we examine the urine, stool, the details about rising up and sleep. We do talk about the digestive power. There are different ways of really inquiring about the person's and individual's life, his behavior, and then continuously each one that information comes to keep on connecting with the possible diagnosis. This is what I would think.
So, sir, when you say Ashtavidha, is Vidha, and what is the significance of that word, just so that I can understand?
With these types.
So, doctor, you mentioned about pulse. Like as a lay person, I have often heard people say that an Ayurvedic physician can diagnose a patient sometimes only with the pulse. Is this true?
I think I have come across these questions, I don't know how many times in my life. Right from the beginning, when I graduated, this question is being asked, put before me. As an Ayurvedic physician, I do believe that the pulse diagnosis has a very, very important contribution to the diagnosis of disease. I've also come across physicians who are able to make diagnosis only with pulse. But as an objective modern day physician, I would look at it pulse as one of the components of making an inquiry. Pulse does reflect what is happening in your body. One cannot deny that fact. There have been efforts to convert the pulse diagnosis into a mechanical modern device as early as in 1994.
Oh, wow.
So many times what you find today is also the reproduction of that. But to me, while I'm examining pulse, I'm also able to infer a lot about patients. I'm not going to the detail of the story, but I can tell you that somebody questioned me. And I said, I will not do the diagnosis. And then after half an hour, when I was forced to take his pulse, I said, I'm not taking your pulse. But I know that you are suffering from peptic ulcer, what we call as Parinamshul, and you had a history, and you had a nausea and such things. And then he was surprised that, how did you do that? And I told him, from your profile, from the pan that we are eating, where you have red lips, the profile is lean, you have fair skin with enough number of peels, and such other influences which can make me diagnose you as a patient of peptic ulcer, that is Parinamshul. This is the beauty of pulse and diagnosis in it.
So then, sir, I'm curious to know, what is your method?
Right. So, I don't know whether you remember, but I have a questionnaire.
Yes.
A very systematic questionnaire that I follow. And I always give maximum time to my patient who comes to me for the first time. And that question is divided into six questions. We don't realize it, but these 6 questions. The first one is we call it presenting symptoms. The second one is related with the personal history. The third one is related with the family history. The fourth part talks about or refers to the habits and the present lifestyle, reflect the present lifestyle. The last one is about any medicine, allergies, because history of medicaments. And of course, you will not know, but at the end we derive a prakriti, priority and prioritization, and the possible category in which the disease falls. It's a very systematic way. Fortunately, I have been a researcher, so what I have done is that I follow it up in the same manner. So what happens is that by the end of that 20 minutes, normally I take 20-25 minutes in my first interaction with the patient, I'm able to infer a lot. I'm able to connect the dots. So from the present symptoms, I go to the history. From history, I go to the genetics or inheritance. From there, I go to habits, the present situation, and thereby then I connect the dots to come to a diagnostic conclusion. This is the way I do.
That's amazing. I have certainly witnessed that. I have been amazed at the things you knew about me. So yes, I thank you. So, sir, the other question that comes up, because we talked about all this in light of diagnosis, is what weightage does an Ayurvedic practitioner give to labs and investigation, lab reports, laboratory results and investigations?
As an Ayurvedic physician, do I ignore it? No. But my priority is definitely going to depend the Ayurvedic way of diagnosis. So if you observe, I don't look at the papers and the reports never in the beginning of my intervention. Only after I complete my first initial process of 20-25 minutes, then only I look at the papers.
I actually noticed that.
Yeah, because I don't want to get my mind prejudiced with
Yes.
a particular diagnosis.
Okay.
And that gives me my own influence, gives me my own strength.
Right.
So whether it is a very simple case of cold or cough, or whether it's a complex case of a cancer, or whether it is some other disease, a simple asthma, or whether it is a interstitial fibrosis, which I will diagnose it differently. So these are the words which I use on the modern diagnosis. But I will infer it all differently. So whereas I respect the modern parameters, but I have my own way of interpreting and, more importantly, correlating with the patient. To me, an average value, the way it is being done, no doubt it gives me some information, some important idea about the disease. But it varies from person to person, and even in the person who is subjected to all variations. So, for example, if a patient is sitting in front of me with high sugar, but if I find that he is comfortable, then I will not get panic. Same situation with blood pressure. Yes, blood pressure should not go beyond a particular level, but at that time I will be making the judgment based on my own clinical inference. The same time, that will be opposite situation where he might be in a normal range. If I feel it necessary to go for investigations to complement my diagnosis, I will not hesitate to do that. Because the technology is available, the process is available. It is my role and my duty to identify what is right for the patient and inform it and use it so as to benefit the patient.
Amazing.
So this is the way I will, I look at the modern equipment, modern diagnosis, modern tools. So nothing is useless. Nothing is of no value. At least I believe in that. The more precision we have, the more specificity we have, is better. But I cannot go away from my basic approach of Vata, Pitta, Kapha, or the Dhatus, or the Sotasas, the way I correlate with the patient who is in front of me as a conglomerate of signs and symptoms.
Thank you. That explains things very well. So, in this day and age, I see a lot of people struggling with their mind. And, doctor, since you are talking about making inferences, observation of the patient, how much are you really going to give relevance to the patient's mind in your diagnosis?
So, I'm really happy that you raised the subject of mind. It's a reality of today that mind plays a very, very important role in the health or the disease status of an individual. We hardly find somebody who is not under stress, right from the young children of 5-6 years of age to a patient of maybe 70-80 years of age. So the mind and stress have not only become the part and parcel of our lives, but people are even anxious about it. How to deal with it.
Yes.
So as an Ayurvedic physician, right from my early days, somehow I had this desire and had that approach that I have never excluded mind from my method of diagnosis. I can't imagine to examine a patient without the correlation with the mind. So whether it is a very clearly obvious, visible, psychosomatic relationship which is visible in the form of a symptom, kind of arthritis or a kind of, say, psoriasis, which I may diagnose differently. Or there might be a classical psychiatric patient as might have come to me with already a diagnosis. And then I might correlate that process, the manifestation, which is purely a physical reason of upbringing or a dietetic habit or a habit of not evacuating in a regular manner and whatnot. So mind and body cannot be separated. The other aspect of mind is the social dimension. Many times, most of the doctors, they do not recognize this. But unless you are inquisitive about the mind, when you are looking at signs and symptoms, you cannot become a good physician. Charaka very clearly mentions that the duty of a physician is to get into the psyche of the person. It is an essential component of the physician to get into the mind of the patient to understand what is happening with the body. So I have come across patients, where we have essential hypertension where it is wrongly diagnosed, but it is more to do with the anxiety status which fluctuates of an individual. And if you work on that, then automatically that becomes control. An episode which might have happened much early in the upbringing age of the person, that can correlate with what is happening today. I know of a dancer of say mid-40s who came much later in with arthritic symptoms. And without going to details, I can say that I could correlate her opting to have dancing as an alternative or as a career objective, so that she can go away from the stress that she was facing as a child. And the whole treatment becomes totally different. So this is an extreme example. It doesn't happen in every case. But yes, there is a mind component. Always in every disease. And Ayurveda recognizes it very clearly in terms of identifying the stature of patient, how the patient behaves, what is the patient's endurance level. Because a good doctor has to make that diagnosis, that what kind of treatment approach I have to have with this particular patient. So whether it is the environmental situation, the social situation, how the patient is going to respond to the treatment, that is also within the realms of an Ayurvedic physician that he has to make a judgment about. One of the important points which I want to make is here at this point is that anybody who goes to an Ayurvedic physician, or for that matter any doctor, the more transparent you are with me, I'll be a better doctor to you. Yes. The more transparent, the more I am able to know about you. I'm able to treat you better. Yes. And that includes, of course, the counseling, because most of the people are not even aware that there is a component of stress or mind. Because most of the people do recognize, but there are many people who are totally ignorant about it. Because that particular factor has become so much part and parcel of their lives that they don't even recognize that there is a problem. And that is where, as a doctor, my role becomes very important to act as a counselor.
I think you're spot on. Yes, as a layperson who's been through stress, I can definitely see that when I'm in it, I definitely don't know that I'm in that pot of boiling water.
Right.
Yes, it's a slow boil. Thank you. Doctor, I have another question to ask, which is to understand that like when you are diagnosing your patient, they're in treatment, and when they start to make improvements, like how do you assess those? How do you mark those? How do you measure that?
Right, and as I referred to my research background earlier, I have a list of signs and symptoms which I follow. And even though each and every patient is not a research patient for me, I treat them accordingly and I mark them grades 1, 2, 3. So most of the time I have to follow up of the symptoms, the way they have appeared or disappeared, or about the severity. Many times patients get surprised when they come to me after say 10, 15 years of gap or something, that with a new problem or new requirement. And when I look at that, they themselves have forgotten what they have suffered. So for me, the critical evaluation and examining it from an objectivity point of view becomes very vital. At the same time, there are times also that patients do have to accept that there are certain situations where they have to undergo treatment for a longer period. Otherwise, I have my own way of examining what is the progress. Though unfortunately today one of the main criteria is that how much the patient's drug dependence on the modern medicine has become reduced. I think unfortunately that has become one of the major criteria nowadays in the last say 10 years. But if a patient is consuming a particular drug, which was given to him or her at a particular age, then maybe it was necessary. And then knowingly, unknowingly, he continued for a long period of time, and then at least I feel that is creating some problem. Then that reduction itself becomes a criteria of benefit. So there are different ways of providing objectivity about the outcome of the treatment. So there are different ways of, and I'm conscious about it. That is the way we do it.
Thank you so much for your time today.
Namaste.